right, so again, my name is Neti Gupta. I'm a new pre-health advisor with the University of Arizona. So myself and Ethan Bull will be facilitating the panel on clinical and volunteer opportunities. So again, thank you so much for everyone being here today. Thank you panelists for being here. So what we will do now is please go ahead and introduce yourselves with your name, job title, years of experience. Feel free to, if you feel comfortable, feel free to share a little bit about yourself and your organization. I will just go down the list on our agenda with no particular order. Actually, it looks like our ambassador is here to facilitate the panel. Hello, Sydney.
Hi.
So I just said good morning. So if you want to just go down the list and the agenda and ask them to introduce themselves, great.
Absolutely. 1 second.
I think we can go ahead and start with Jody Kazanke, as you're the first one anyway.
Okay, all right, so just go ahead and talk. Okay.
Yes,
all
please.
right. Hi, my name is Jody Kosanke. My background is respiratory therapy. I've been a respiratory therapist for going on 45 years now. At this point, I'm retired. The last 5 years of my career, I actually worked at the College of Medicine, working with pre-meds, pre-pharmacy, pre-nursing, you name it, pre-PA program students, trying to get into their different professions. So those students who come and volunteer at Workship are students that I give 2 hours worth of, basically you volunteer for 2 hours, I give you 2 hours of free kind of guidance, counseling on how best to get into the chosen profession you're trying to enter. And once I retired from the U of A, my students kept telling me about this wonderful opportunity called the Workship Project at the Z Mansion. And it's basically a free homeless clinic serving, again, the homeless and the underserved in Tucson. And before that, working 60-hour weeks, I just couldn't do it. But now I've been volunteering at Workship for 6.5 years. So what's great about Workship, and we actually have 2 volunteers on the panel, Noah and Sydney, both are Workship volunteers. And so they can throw in a little bit too. But basically what we do is we're a feeding center. We also help to clothe the homeless. We have shoes. We have social services that come. On Thursdays, we have a nurse practitioner from El Rio that comes and administers vaccines and actually does care visits for, or basically appointments for our homeless folks. And but what's also great is at the clinic, students who are looking to get into nursing or into especially medical school, you get the opportunity to work one-on-one with patients. And we do a lot of foot care. We have a lot of diabetics out there in the community. So this is our way to keep assessing their feet, making sure that, you know, sometimes just looking at somebody's foot, we can tell they're either pre-diabetic or they're full-blown and they don't even know it. And by doing things like that, doing wound care of all sorts, I mean, we've taken care of 2nd and 3rd degree burns with the guidance of the nurse practitioner and physicians that come and basically give us guidelines of what to do. But, you know, the biggest part of Workship is learning how to work with a diverse group of patients. We do see a lot of mental illness, drug dependency, but not as much as you would think. Everybody thinks if you're homeless, you're a drug addict or you're an alcoholic. Not everybody is. And so that's what's great about Workship is you get to know the clientele. And when it comes to interviews, that's one of the things they ask. And they'll say is, you know, give me your perspective. How has this changed you as a person? Is it going to make you a better healthcare professional? And it absolutely does. It helps you understand the different stigmas and discrimination we see, and also learning how to build respect and rapport with patients to where maybe the first 2 times or 3 times they come, But after that, once they know that you really do care for them as a person, they're a human being, they're not just a homeless person that's worse than a dog on the streets is sometimes how these people are treated. But we give them back their dignity and their respect, and then we're able to really do a lot more to help them to get the medical care they need, to get into housing that they need. And plus it's fun. Anybody can come, anybody, but especially if you're looking to get into a healthcare profession, it really carries a lot of weight. Again, your insight into how to talk to these, to the homeless, to the underserved, and it just gives you the ability to really connect with people, and that comes through in interviews when you're trying to move on. And it's, like I said, it's a wonderful experience. And if you don't want to do feet, if you don't want to, clean up kind of gooey looking wounds and things like that, you can work in the kitchen, you can hand out clothes, you can just go out and learn how to assess patients and say, you know what, I saw Bill here the other day and he just doesn't look right today. How to assess them and get them back so that we can get medical treatment for them. So that's kind of workshop in a bundle. I don't know, Sydney or Noah, do you want to add anything to that as volunteers with me?
I think you summed it up pretty perfectly, especially just with the building of the rapport. I know personally, every time I come and volunteer, I love seeing our quote unquote regulars and touching base of what they're up to nowadays and things like that. But I think you did a great job of giving a beautiful description.
Okay.
Next up, we do have our Dr. Alejandra Zapian. Would you like to share a little bit about your program?
Sure. Thank you, Sydney. Good morning, everybody. It's a pleasure to be here. And I'm glad to see this many students interested in working towards their careers on a Saturday. So I'm Alejandra Zapian Hidalgo. I work at the Office of Equity, Diversity, and Inclusion at the Arizona Health Sciences. And we have different programs at the office. We have the program called Conversantes. This program has a two-part. I'm sharing the link to the program in the chat box. So we have a two-part program. One part is in the class, the other part is in the community. So the students have the opportunity to either volunteer at COP Clinic, which is committed to underserved population and is run by medical students. And also at Clinic Amistad, what the students do there, and the special skill that my students have is they speak Spanish. So they serve as lay interpreters for our very in-need community. We know that if you're applying to any health career, you need those either volunteer hours or clinical experience. So this is a great opportunity for you. Maybe, I don't know, you need to work and you haven't take the time to make those or work towards those hours. This course is an amazing opportunity for you. We also have at the office another class called Med for 93, and maybe Dr. Yellowbird already talked about it. And the students have the opportunity to shadow at least 2 physicians, or depending on the career they want they're applying or preparing for. So those, excuse me. Those are the opportunities that we have at the office. And also as part of all the programs that we have right now, we're recruiting for the program of it's called Conversantes and Frontera. And Frontera is a summer internship. We have sometimes the opportunity to offer volunteering opportunities. I don't know if you're familiar with Casa Alitas. Casa Alitas is an organization receiving asylum seekers, and they need, obviously they receive at least like 50% of the population speaks Spanish, and the other 50% either African dialect or from other Portuguese, maybe from Brazil or from Portugal, and also indigenous dialects from Guatemala, Belize, El Salvador. So those are the programs that we have at the office, and I'm open to questions after everybody presents their programs. And thank you for being here.
Thank you so much. All right, up next, we do have Roger Kuntz with Hospice. Roger, would you like to introduce yourself and your program?
Sure, thank you. Good morning, everyone. Thanks for the opportunity to come and talk to you about our volunteer opportunity. So basically, I work at a hospice, and a hospice is, as you, I'm sure, probably know, it's they're there to care for people in their basically their final days or months or weeks. A lot of our patients have serious illnesses, anything from cancer to heart disease to lung disease. Those are usually the top ones, but there's other diseases in there as well. And basically, they've had a doctor evaluate them, and it appears that if the disease runs its course, that the patient will actually die within 6 months. That's how they have to have that qualification to get onto a hospice service. Now, a lot of patients, hospice patients, they're still able to certainly communicate and socialize and talk. Most of them are living at their own homes still. And so a lot of these patients would like a visitor. So what we use volunteers for is to go out and visit these patients. So when the volunteer goes out to see the patient, they're socializing primarily. It could be anything from just chit-chatting to watching a television program with them, maybe listening to music. It could be reading a book to them, reading poetry to them, reading the Bible to them. It could be any of those things. But basically, we're just trying to keep the patient company and also give the caregiver a bit of a break in terms of we would be there with the patient, perhaps while the caregiver ran down and obtained groceries or had to go to the bank or get gas in their car. So our primary thrust is to try to get volunteers in to visit the patients. In order to get you there as a volunteer, we train you, we orient you to hospice and basically kind of educate you to what that's all about. That's not a real lengthy process. I usually do one-on-one orientations. We do give you a TB skin test to start out. We prefer that you're vaccinated just because it's just easier to get you placed into visiting a patient if you've been vaccinated. Had a number of volunteers over the years, and I just was reminded by Josie that I've been able to come to these pre-health information blasts for like the last 9 years. And so we've really had some wonderful students. A number of those students have gone on into medicine, some into nursing, some into physician's assistant programs. I mean, just a number of those things. But I'd say probably the largest benefit that a college student is going to obtain from a hospice is you actually direct patient contacts. You're actually with the patient one-on-one on a weekly basis many times. The other thing that it's kind of an education for students. They can actually come in because they can actually sit in on some of the team meetings where there's discussions about caring for the patient, the medications the patient's on, how they're treating things, how they're dealing with some of the family problems, how they're dealing with some of the spiritual issues. So it's a really good education about hospice. So we need volunteers now. It seems like patients and their families are starting to open up and want volunteer visits again. So I would say right now, Amedisys Hospice probably has probably 5 patients right now that could use visitors. So that's what we are, and we would welcome you. You can certainly call us or email me, and I will try to answer questions personally over the phone or email. So would love to talk to you. So thank you very much.
Thank you, and thank you for continuing to contribute your resources for so many years now. Thank you.
Thank you.
Next on our panel, we have Celina with the Disability Center.
Everyone, thanks for having me. I'm Celina Urquidez, and I'm the Education Coordinator for the Sonoran Center for Excellence in Disabilities. You might have also heard us referred to as the Sonoran UCED. So what's a UCED? So UCED stands for University Center for Excellence in Developmental Disabilities. And they exist in every state to serve as a resource for people in the areas of education, research, and service relative to the needs of people with developmental disabilities in their state. So at our UCED, a major portion of our education component, we have a few student training programs. So we offer a handful of interdisciplinary training programs. So what that means is we have students from all over campus. So it doesn't matter what your major is. We welcome students from every discipline to participate with us. And so our goal is to help our trainees gain skills and knowledge to become leaders and advocates in areas of disability by exposing you and engaging you in disability research, practice, and even policy. So I'm going to put a link in the chat to our website about our training programs, but I'll go over them briefly. So our programs include the undergraduate certificate in developmental disabilities. So it's a 1-year, 12-unit program where we invite undergraduate students to engage in a mixture of research and community-based coursework. And it could be in the areas that are of interest to them. So it doesn't have to be a specific topic that they do their research or their community outreach for. It could be what fits your interests and your major. So we're currently accepting applications for the 2022-2023 school year. And so the deadline to apply to that is December 31st. And I can put a link to the application in the chat as well. But we also have a couple of fellowships. We have a diversity fellowship where students are doing some in-depth work on a variety of different topics, such as youth to adult transition and inclusion. We have a policy fellowship where students are learning more about the policy process. And at the end of the year, they develop a policy brief that relates to disability, and it's hopefully going to be sent to local policy representatives who, because our students are going to be advocating for some sort of policy change or a new policy that will positively impact the disability community. And then lastly, we do offer different types of volunteer and internship experiences. So where students have been given the opportunity to engage in firsthand in community service, community outreach programs, disability services, and help with data collection for a number of our research programs. And so I can put the link to apply to that opportunity as well in the chat. Thank you.
Perfect, thank you so much. And next up on our panel, we have a student scribe. Kellan, would you like to introduce yourself?
Yeah, hello everybody. Thank you for having me today. My name is Kellan Martin. I am a senior at the University of Arizona, so it's my last year. And I'm going to be talking just a little bit today about medical scribing, which is a really great pre-medical experience for those who are interested in medical school, PA school, which is physician assistant, or NP school. And I just say for 2 years and up until August. So I have over 2,000 hours of experience doing it. So what is medical scribing? So medical scribing is a really great opportunity. I like to say that it's a 3 birds with 1 stone kind of thing, because it's clinical experience as well as shadowing, and it's paid work. So what a medical scribe does is they essentially spend the entire shift with a physician, whether that's in a private practice or the emergency room like I did. And you spend your whole shift with your physician, and you go from all of the different patient rooms with them, listening to their interview of the patient, as well as watching their physical examination. And what you do is you document everything that occurs during that patient encounter. And then you go back to the room with the doctor, you get to discuss the case with them. It's a really great experience. You have a huge exposure to medicine, whether it's primary care related or again, in my I'll send the link to that website in the chat. And a lot of people ask me how I got involved in scribing. It was actually something that was brought to my attention my freshman year of college. A hiring stuff out on the mall at the U of A. I grabbed one of her cards. Then we got started with the hiring process. It is a very high demand job, actually. So I recommend to everybody to just really, there's a lot of different scribing companies like ProScribe, OneScribe, Scribe America, and reaching out to them via LinkedIn, looking for job offerings, and just sending in your stuff and getting started. So yeah, I'll send that link in the chat, and then I'll be here if anybody has any questions. I have so much I could say about it, and there's just never enough time. But yeah.
Okay, perfect. Thank you so much. So that is all of our panelists for the clinical and volunteer opportunities. However, we do have a little bit left time. So one question that I know that frequently gets asked that kind of leads into our next panel is, have you, of any of our panelists, written any letters of recommendation for your volunteers?
I can answer that one. I write for all the students that ask me. I'm very honest, but I also ask for your input so I can put in other things that you're also doing. But and I will say I have been contacted by schools saying, wow, can you help us start this program at our school, just because of the actual experience the students get. And I will post the link of the hours for workshop also. I think I only sent them to Noah, so I will figure out how to send them to everybody. But that, and I also wanted to say, and this is going for Roger, how hospice, it's almost like you get brownie points for doing hospice volunteering, because being in somebody's home, you're going into their environment, and also dealing with people that are at the end stage of their lives. That really gives you a different perspective altogether. So hospice volunteering is very, very good too, besides workshop. So, okay. Roger, I'll turn it over to you.
Oh, well, thank you so much for those kind words. That was very, very nice of you. So I'm kind of like Jody in this situation. I believe that everybody that's asked me for a letter of recommendation, I have written one for them. Now, I try to coach the student along the way and tell them, these are some of the things I need you to do for us that will help me to write you a good letter of recommendation. Like, you have to take on some volunteer assignments. You have to be basically dependable. If we need a little help in the office, you might be flexible and come and help us in the office. So I try to help them build the case where I could write a really good letter of recommendation. So yes, I do try to do that. I think I've written all that have been asked for. Maybe one I could not, because there just was no volunteer experience at that point for this individual. So, but I'd say 99% of the time I have agreed and have written one, did my best to write a good one. And so, yes.
Yeah, I second what you said, Roger. I've been teaching for the past 10 years, and I've been writing letters for students that have been through our programs, Conversantes, Frontera. And the good thing about our programs, we have a small size groups. So it's easy to get to know them, and it's easier for us, or at least for me, to write a letter of recommendation. Something that I will suggest, and so you guys have that in mind, is ask for the letters in advance. If you are thinking on applying to medicine, start asking for those letters like 2-3 months in advance, and send your personal statement and your curriculum, so we have a better idea how to present yourself in the best way we can. So that's my part.
Awesome. Thank you guys so much for giving that insight, because it is really helpful, especially as a pre-health student myself, to really know how to achieve that recommendation part. And in the next panel, we'll go a little bit more into depth about how asking for those, but it's really good opportunity to, like Kellan said, kill two birds with one stone. That's what I'm saying. Just make those connections and make those personal relationships through that volunteering opportunity. But with that, that does close our very first panel. We will be having a 5-minute break between our next panel. So panel 2 with getting to know faculty will begin at 10:30. So please feel free to use that time to whatever you need to do, and then rejoin or stay on this room and come back for our next panel. Thank you so much.
Can I ask real quick? So
Yes,
someone
sure.
asked for Roger, how do students get in contact with you if they want to volunteer with Amadeus Hospice?
All right, so the fastest way is our telephone number is 520-205-7700.
Cool,
So,
awesome.
So thank you for asking that.
Thank you all, and we'll have a 5-minute break, as Sydney said.